Hello Malaysia and welcome to episode 7 of Medical Today. I'm Sivaratnam, and as always we have a show packed with information for you and also some fantastic interviews. Now our show mainly focuses on improving health and enhancing lives. That's all we want to do on a weekly basis right here on Medical Today. Now our topic to start off episode 7 is about healthy aging and SDGs. It's an acronym for Sustainable Development Goals. And joining me in the studio is Dr. Navindra Nageswaran, Group Medical Director for Global Doctors. You know him, he's been here every week since we started season 2. And joining him is Dr. Liyana, family physician from Global Doctors Mont Kiara. They join us to talk about, of course, our topic today, which is healthy aging and sustainable development goals. Welcome to the show. Thank you very much for taking time off your busy schedules. Dr. Navin, we'll start off with you and talk about SDGs, or Sustainable Development Goals. What are SDGs?
Sustainable Development Goals were started by the United Nations in 2015 in view of a 2030 goal. There were 17 goals set up for developing nations to follow and a guide to abide by. So in relation to today's talk that we are doing, it's about aging and sustainable development goals.
Now, when we talk about countries that have jumped on board to make this happen, some sort of treaty had to be ratified, right?
Yes, correct.
And I think that is still happening. But have we seen a significant move forward with regards to this?
I think so. Like for example, let's start with, there are totally 9 in regards to aging. I will mention 5 of them and we'll give Dr. Liyana the rest. And the first 5 will be actually poverty. Okay, there's no poverty, zero hunger, and then good health and well-being. And the other one will be quality education. And the last will be sustainable cities and townships or communities developed. Now, the poverty, like PECA, was just launched on the 15th of April. That's what the government is doing to help the poor people have access. Good health and well-being is making sure that the people can have good access, universal healthcare within Malaysia. So if you notice what the government is doing today is exactly in line with what they have ratified in 2015 and hopefully by 2030.
So this goes back to what you were saying the other day, talking about primary health care and how important this is.
Yes, exactly.
Bringing it down to the B40s. I'm going to come back to you shortly, but let's move to Dr. Liyana. Welcome to the show.
Thank you so
debutante
much.
on Medical Today. Well, what is healthy aging? Let's talk about healthy aging for a while. Now, all of us have different opinions as to what healthy aging is. What is it to you?
So healthy aging, you want to live a long life where you are able to do whatever that you desire. So you want to be healthy enough to not depend on anyone. So the UN has created this because we want to involve all ages, all genders, and not exclude anyone. So the point is basically to not leave anyone out. So sometimes we tend to look at the younger generation. We don't want to have a world where they cannot live in, but we also tend to forget about the aging population, which actually are the majority of the global population these days.
If I were to digress a little and talk about the aging population in Malaysia, you see a lot of people come and visit you, of course, for the checkups. What do you think one of the bigger problems with Malaysian aging?
So with Malaysia, I would say that we have room to improve on our infrastructure and institutions especially. Of course, we want to improve on those things to give them a better chance to have easier access to healthcare, easier access to social services as well.
Right. Now, coming back to you had something to add to that?
I just wanted to add on, you talked about healthy aging. It's rightly said, we all aspire to live healthy. We all aspire to be healthy physically, mentally. But we need also the environment, because as we grow older, we need to change the environment, change the setting we are in, and comfort. Basically, that's what we are looking for, and that happens as you're growing older. That was what I wanted to add.
So, I mean, what we need to do now is bridge that chasm between the have and have-nots.
Correct.
Now, having said that, help me make some sense out of this, okay? By 2050, apparently the world's population of people over the age of 60 is going to double. How could you make us understand this a little bit more?
Basically, what's going to happen is healthcare cost is going to go up. That's the first thing that's going to happen. People are focusing on acute care. Today in Malaysia, we've got all 150 government hospitals, you've got a lot of private hospitals. Everyone's focusing on acute care, but they've left out chronic care. And that's what the current government or the Minister of Health, the first thing that he came on position, he mentioned about NCD, he mentioned about chronic disease, because he has to bring it back to primary care. They're the gatekeepers. So if you start from chronic care, then you might be able to assist, yes.
Now, going back to the list of Sustainable Development Goals, there are 9. You mentioned 5. Dr. Liyana, would you like to continue with the list of SDGs or Sustainable Development Goals? I like how that sounds.
Sustainable Development Goals.
Yeah.
Yes. So goal number 5 is gender equality. So as we know, women tend to live a little longer than men on average.
Always.
Always. So basically, a large group of females are actually the majority of this aging population. So women play a major role in household, workforce, and sometimes because of their limited or restricted participation in paid workforce, they tend to have problems later on in life. So they might not have pensions, they are at high risk for poverty, you know, and they have more trouble to actually access healthcare and social services. So basically we want to reduce this poverty, want to reduce this problem. So we want to have gender equality whereby both men and female have equal participation in the workforce, paid workforce, so that have pensions, so that it will actually help benefit in future and the later life.
Just to continue on what she's saying, when we say gender equality, so on and so forth, of course we're working towards it.
Yes.
But you know, some say it's wishful thinking. But I see a lot of progress in that area. What are your thoughts, Dr. Navid?
I think we're progressing well. I think again, I think they just added up EPF funds and payments for the women at home, housewives. That is actually the first thing that you can actually think of. What you just mentioned about not having enough funds to have their shopping and for their grandchildren to buy food, because nutrition is one important thing for the older generation, and having this little extra cash will actually make a big difference.
Now, coming back to you, and I'm going to very quickly jump into nutrition. Now, they say to reverse a lot of diseases, nutrition is very important, and a lot of people talk about healthy eating. What are your thoughts on healthy eating?
Healthy eating is important at all levels, whether you want to stay healthy or whether you want to prevent diseases. So it is very crucial to even start from the beginning, because of course we want to prevent it rather than cure it.
Right. The reason I say this is because a lot of us think that we go to the doctor and there'll be this one pill that will cure all our diseases.
Everybody's expecting it.
Everybody.
But believe it or not, all the pills that we prescribe do have issues.
Yes, of course,
We are not
and you don't want
we don't have those magic pills. We actually create, if you go for diabetes, we actually create the cholesterol. Probably go for cholesterol, we create the hypertension.
That's true, that's
so
true.
it's all connected. There are 3 friends that you don't want to have, which is diabetes, hypertension, and cholesterol.
Right, which comes under the umbrella of non-communicable diseases.
Under chronic diseases.
Chronic diseases in Malaysia, and a lot of us, and a lot of people say that it's that fast food diet which is also contributing to that. What are your thoughts on this?
That's true, because with the lifestyle.
Are you a fast food fan?
No, not really.
Not
actually,
really.
As you age, you tend to not want it anymore. But that is very important, because back then there were not many facilities of that sort. So maybe the lifestyle was different. They lived harder lives and things like that. Now with a phone call, you get food delivered to your doorstep.
Right.
So
And fast food. Actually, you can't blame the fast food. It's just that it's the process. The proteins are lost. The nutritions are lost. So how else? Because you cook, your parents also cook fast food at home. They can really make a quick one too,
they
right?
can. They can whip it up if they
whip
want
it up
to.
really fast. So McDonald's are very much not different.
Right, we're going to come back with aging vision and falls. We're going to do a bit of review about that. But before we go there, maybe you can round this up on SDGs. What's your takeaway on SDGs?
I think it's a set of goals that has been put to attain by 2030 by the United Nations. And Malaysia is one of the countries in it. So I feel that everybody should take part, especially the primary care doctors, hospitals, everyone should use these 9 goals that we just mentioned out of the 17, because the 9 is relating to aging, and aging is going to be 20% of our population by 2030. So we should strive to keep them healthy.
I hope I see you there. We're going to take a short break, and when we come back, we're going to continue with this discussion. Of course, we're going to take it further afield by talking about aging, vision, and falls. We're going to do a little review with Dr. Liyana and also Dr. Navindra when we come back right here on Medical Today. Stay with us.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Essilor lenses go beyond my correction. Their Creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never tired Dragon Eye Eyezen.
Ask your eye care professional. See more, do more. Essilor.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Essilor lenses go beyond my correction. Their Creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never tired Dragon Eye Eyezen.
Ask your eye care professional. See more, do more. Essilor.
Hello Malaysia and welcome back to Medical Today. We are now moving into aging, vision and falls. A little review for you. Joining me, like I said before, Dr. Navindra Nageswaran, Group Medical Director for Global Doctors. Also with us in the studio is Dr. Liyana. She's a family physician, a primary care physician. What's the difference with this?
Well, family physician is a specialization and primary care physician is basically, we are in charge of the primary care. So when you go to the clinics and things like that, we are the primary care physicians.
I mean, it might be a simple, first line of defense. It might be a very simple question, but I only got to know about this when I met Dr. Navin. And and how important primary care is. A lot of us talk about primary, tertiary, secondary, quaternary, but primary is the most important, the first line of defense. Exactly. And having said that, let's move into what we want to talk about. Let's talk about aging and the eye. What are your thoughts on it?
All right, so we all age, yeah? So as we age, our body
glasses
changes.
are very thin.
They become thicker and thicker. Yeah, so of course our eyes are no exception. So our eyes also go through some changes as we age. So especially when you reach 40, you realize like, oh, like, you know, you're going further and further away to read.
You need a longer hand.
You need a longer hand. You need like a further away. So that's something called presbyopia, which is basically normal changes that you go through as you age. Certain things like dry eyes, because your tears start to also produce less also. Those are certain changes that you see in aging eyes.
Right, Dr. Navin, when you talk about presbyopia or eye problems, what age, you know, they say it starts in your 40s. For some people, it can start in their 30s. Why does it start early for some people?
It's very variant. It all depends, because sometimes people use their eyes, a lot, especially with their phones, thanks to technology.
Right.
And, you know, you bring it closer and closer, you use more of it, or you sit in the TV and watch really close. You know, you're like literally 3 feet away from the TV. These are the reasons why it happens more comparatively. And reading in the dark is another area that is actually not recommended. We should have the lights on when you read.
Right. Now, when you talk about common eye conditions associated with aging, what are the common eye conditions?
Age-related macular degeneration.
Age-related macular degeneration.
Yes.
Yeah.
It sounds complicated, but it's basically what the name says. So it's age-related, and it's degeneration of the macula. So basically, the macula.
Is the back of the eye.
Yes.
Yes.
Yes. So it's basically, it helps with central vision.
So the back of the eye degenerates, basically.
Yes, it's on the retina. So what people go through with macular degeneration is that they lose the central vision. So they'll have a peripheral vision, but they might have problems reading, maybe recognizing faces, because that's your central vision.
So peripheral vision, a lot of people won't have problems with it.
You
Central
might
vision.
also have that. So like glaucoma will...
More bad news.
More bad news will
Yeah.
actually affect your peripheral vision rather than your central vision. So it's
You have
slowly
diabetic
occurs.
retinopathy.
Yes.
You're talking
Right.
about the back of the eye.
Right.
Chronic diseases, actually, like what we were talking about, NCDs. Diabetic retinopathy is one big problem that we face, and a lot of people don't check it.
Now, here's a question that was sent to us via email, and someone asked if your eyeballs shrink as you age.
Actually, the eyeballs don't shrink.
The eyeballs don't shrink? No.
But what happens is, if you look at our face, you have all your cheeks, your muscles, and everything around here. They all kind of shrink. So it makes you look like as if they shrink.
Okay.
So if the wrinkles stop, so a little bit more eye cream, a little bit more makeup and all that kind of stuff, then keeps your eye look okay. But the eyeballs don't shrink.
Don't shrink at all. So it is.
But it makes it look like it's shrinking.
Right. It's all very visual.
Sockets around it.
Now, how do you protect your eyes as you age? You know, what would be your go-to advice?
I would think the first thing you need to do is read in bright light. Okay. Drink a lot of water. Okay. Hydrate, because in Malaysia the humidity is very high, so you have to drink a lot of water and keep it humid. The other thing is you have to tend to make sure the eyes are not dry, because we live in the air conditioning condition. We tend to keep our eyes dry. These are the main three ones that is it. And multivitamins, something to keep your eyes. That's inevitably you have to keep.
Yeah, but that's also another problem. A lot of people go to a pharmacy and they're always getting what do you call that, multivites or special vitamins for the eyes. As primary care physicians, people, first line of defense. Well, what would your go-to standard of advice be for this?
I think the first thing I would say is invest in the good sunglasses.
Okay.
Definitely.
We are
It's
in the
not
tropics.
just to look
Right.
good,
We
but
have a
it
lot of
does,
sun,
it
and
helps
the older the
protect
person gets, the sunglasses tends to disappear. So you have to get a good pair of sunglasses.
Okay, so how do we define a good pair of sunglasses? Here's the other thing.
You have to have
By brand?
It doesn't have to be
Not really,
expensive.
It doesn't-
All
okay.
it needs to do is it should protect against UV light. Like even for instance, people who wear glasses, they tend to not want to buy sunglasses because then it doesn't have power and things like that. But nowadays there are things like transition lens. So those are well enough and good enough to protect your eyes from the UV light.
Right. A lot of us, as we get into our 40s, get into midlife, especially boys, we have midlife crisis, so on and so forth. And some of us worry about our eyes, the degeneration of eyesight. Now, can anything be done to lengthen the longevity of your eyesight?
I have not read about it, nor I have not heard, but prevention.
So basically, how can I stop my eyes from aging?
Basically, like what we just said just now, try not using the phone in the dark.
Okay.
Try not, sitting and reading in a dark room. Try to use bright lights, and probably remove the blue light from your phones, because the phones now are the biggest, closest agent that's causing this whole problem with your eyes. And the rest of it is like sunglasses, and you just have to take care. I don't think there isn't anything that's proven enough to slow down this process.
Right. Dr. Liyana, what are the warning signs of problems or eye problems?
So there are multiple. So basically any problem with vision, whether it's central vision, whether it's peripheral vision, if you see any spots, if you see anything floating, like it's called floaters, or if you have a sudden black spots or shiny lights that you see, those are all things that you actually need to look into, and not go like, oh, I'll just wait a few months, You should get that checked.
Okay, so once again, if you see a dark spot, or if you see floaters, are things that are just moving in front of you.
Yes, it looks like black spots, but they are just like floating in front of
Sometimes
your
it could be like snow spots.
Yes, it could be white
They'll be
as
floating,
well.
like, and you're feeling that you want to catch it, and you can't catch it. That's floaters.
Right. Now, with that, another problem when it comes to aging also is our balance, our sense of balance, and our eyes have a lot to do with that. What would be
Actually,
some of the takeaway points
there
from
are
this?
three things on the fall, the vision. At the same time, there's fall risk.
Right.
Now, your vision, actually, the fall risk then creates fractures. And once you have fractures, it's catastrophic.
Right.
The whole thing changes, your whole lifestyle changes. After that, you need to heal, you have to get better, and there's a whole lot of process for you to work with. So basically what happens is that our eyes are able to see and you're able to balance. But at the same time, we've also got a sense of balance. If someone says about vertigo, so you need to address it quickly. Is it your eyes causing the problem, or is it the balance? So early detection and early treatment is very important to avoid the fall risk.
Right. So if I have these kind of signs, like my balance is out, or I'm seeing floaters or black spots or anything like that, what do I tell my primary healthcare physician?
You should tell the primary care healthcare physician, and after that examination, I think like any primary care physician, we will refer to an ophthalmologist, where you'll sit on a slit lamp, dilate the eyes, look at it properly, and find the root cause of the problem. Not just go to a spectacle shop and buy a pair of glasses.
Right.
That's what normally happens.
Or buy it from the Pasar Malam, even worse. And Dr. Liyana, before we close, I'm going to have you have the last say as to how we wrap this conversation up. What are your thoughts on what we just talked about?
All right, so it's very important to live a healthy lifestyle, So eat healthy, do the exercises, stop smoking. Smoking is the root of everything, and you want to prevent that. And awareness, basically, especially for the eyes, regular checkups will do wonders for your eyes to help prevent, to catch it early, and to do something before it gets worse.
Right. I said I'm going to have you have the last say, but I'm going to have my partner in crime have the last say. Dr. Navin, what are your thoughts? Very quickly.
We've given 2 pairs of eyes, and we need both pairs of eyes, because you need to have that good vision. At the same time, to take care of them, it starts from the age of 40 when presbyopia happens. So we just have to take care of it. Follow all the advice that we said just now. Bright light, work hard on it. Don't injure your eyes that you have given.
On that note, thank you very much, Dr. Liyana, Dr. Navindra Nageswaran, Group Medical Director of Global Doctors. Dr. Liyana is a family physician from Global Doctors Mont Kiara. We're going to take a short break. When we come back, we're going to bring you more on episode 7 of Medical Today. Stay with us.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Essilor lenses go beyond my correction. Their creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
Hello and welcome back to Medical Today with me, Sivaratnam. We now take a look at prostate cancer, diseases of the genitourinary system, prostate cancer at your doors. That's our topic. And our on-site host, Nurata Amin, got to speak to Dr. Thana Balan, a resident consultant urologist from Makotha Medical Center, and also Mr. Sagaran Ayappan. He is a patient. He suffered from prostate cancer, but it was a very light-hearted interview. Very informative. Let's take a look at this video and come back. Nurata Amin speaks to Dr. Thana Balan and the patient, M. Sagaran.
Matters of the prostate cancer are sometimes embarrassing to most men in Malaysia, and many shy away from speaking about it even when they are experiencing obvious symptoms. Symptoms such as urine flow being slower, burning or pain during urination, loss of bladder control may be an indicative of prostate problem or an initial stage of prostate cancer. Understanding the cancer early is the best prevention method to avoid it.
Welcome to Medical Today, Dr. Thana.
It's a pleasure to be here.
Prostate cancer is now the fourth most common cancer among Malaysian men. Is this a serious cause for concerns among men?
Of course it is. At this era, to have prostate cancer is the fourth most common cause of cancer in men. It's really concerning.
And the progress of the problem itself in Malaysia within a few years. Your opinion?
Yeah, well, prostate cancer was not so common, let's say 10, 15 years ago, especially in the Asian countries. The reason being, of our dietary things, it was not so common as what it was in the West. But the recent past 5, 6 years ago, we have seen more prostate cancers because there's a change in our lifestyle.
Right. So every man should take this seriously?
Well, prostate cancer, every man should take this seriously because, once you are diagnosed with prostate cancer, there is a lot of effect in the quality of life, all right? I have seen patients of mine who has got prostate cancer, after getting proper treatment, they complain their marriage life is disrupted. Because if you don't treat well, you can have lots of problems. Erectile dysfunction can set in, right? Problems like incontinence of urine can set in. So all these things need to be discussed. So every man should take prostate cancer seriously. Prostate cancer is a spectrum of disease. You start at the early stage and then you go into a late stage. Men who are already above age of 40, they should have their prostate screened.
Okay. What stages are there?
Okay. Well, when we talk about prostate cancer, we have got something known as an organ-confined prostate cancer, meaning the tumor is within the prostate gland. That's the first stage. Now, the second stage that you have is known as a locally advanced prostate cancer. Right. That means the tumor has gone beyond the prostate, but it's not spread anywhere else. And the third stage that you have is known as a metastatic prostate cancer, where the tumor has gone to other parts of the body. So the treatment varies from each stages.
So before we go to the treatment, what are the early signs?
Well, men above the age of 40, should have their prostate checked, because, there's no signs of prostate cancer. The signs that they usually have is because of enlargement of the prostate. Things like frequency passing urine, not able to pass urine well, at nights getting up, 2-3 times to pass urine. After passing urine, they feel incomplete, voiding, incomplete passing. These are the signs that they have. And lots of men neglect this because they think it's just a normal prostate symptoms.
How to prevent prostate cancer, and what are the measures to take?
Right. Now, prevention of prostate, look, there is no prevention of prostate cancer. What you need to do is you need to screen on a regular basis. Screening in the sense, if you have got a high risk, meaning your father, your grandfather has got a prostate cancer, you are supposed to check your PSA at the age of 40. And every 3 yearly after that. Every 3 yearly after that. That's very, very important. Dietary advice, is very important in the sense, you should stay away from fatty food, high cholesterol food. That's the reason why we see a lot of prostate cancer in the Western countries compared to the Asian countries. The diet modification is very, very important. Besides that, there is no other, men who have got hormones, we have got testosterone, there's always a risk factor of having a prostate cancer.
Okay, doctor. Is prostate cancer curable?
Definitely. Prostate cancer is curable.
So what are the types of treatment?
Sure. So prostate cancer all depends on which stage you come with. If you come with the first stage, you can completely treat or cure your prostate cancer.
Okay.
If you come with the third stage, that means it has spread to other parts of the body, there is no curable treatment. We can just control it. The type of treatment that we have for organ conflict, that means early stage prostate cancer, we have got surgery, we have got radiotherapy, and we have got active surveillance. Active surveillance is something that's it's been there for the past 10 years, because of the complications associated with radiotherapy and surgery. So a lot of Western young patients, they opt for active surveillance. Me being a surgeon, I will always tell my patients to go in for surgery. And there are 3 different modes of surgery that can be done at present in Malaysia. We have got robotic surgery, where it's a keyhole surgery. We have got laparoscopic surgery, and we have got the conventional open prostatectomies. So these are the 3 forms of surgical procedures that we have. Now, comparing surgery, radiotherapy, there are not much of a difference. Patients who are not candidate for surgery, we will advise them to go for radiotherapy.
All right. So which surgery or which treatment you think is most effective, proven most effective?
Yeah. It all depends on the histopathology of the biopsy that we do.
Right.
Now, when a patient comes with a prostate cancer, we need to have a tissue diagnosis. That's known as a biopsy. Now, in the biopsy, there is a grading known as a Gleason score. Now, this Gleason score we have from 6 to 10. Gleason score of 6 is known as a very harmless tumor. Gleason score of 7 is known as an intermediate tumor. And a Gleason score of 8, 9, and 10 is known as a very aggressive tumor. So for surgeons, we are, for us who treat prostate cancer, this Gleason scoring is very, very important. Let's say if I have a patient with a Gleason score of 6, and he doesn't want to go through the complications of surgery, I will put him on active surveillance. Active surveillance means doing nothing, observing the patients. He maintains his erections, his continence, and I will see him, I will definitely monitor him every 3 monthly, and every yearly I will do a biopsy for him to see whether the tumor with a Gleason score of 6, as I told you, it's a very low risk, has it migrated to a higher grade. If a patient with a Gleason score of 7, 8, 9, 10, I will tell them to go in for a definitive treatment. The definitive treatment in the form of surgery or radiotherapy. Me being surgeon, I'll always encourage my patients to do surgery.
Surgery.
Yeah.
I think you've touched a bit on the following question that I'm about to ask you, Doctor.
Sure.
What happens when someone has prostate cancer?
Sure. Now, a patient who comes to me and says he has got a prostate cancer, there are a few important questions that I want to know. The first is the PSA. PSA is known as the prostate-specific antigen. I want to know what is the level of the PSA. Now, there are some criteria that we take. You know, a PSA of less than 10, is usually organ confined, meaning within the prostate gland. PSA 10 to 20 may be, locally advanced. And PSAs above 50, they have usually, spread to other parts of the body. So PSA is something very important for us, urologists. The second thing that's very important is the Gleason score that I told you, Gleason's, what is the grading of the Gleason score? That's very important for me to decide on what's the treatment plan that I have for the patient. The third investigation that I want to do is known as a MRI of the pelvis to see whether the tumor has gone beyond the prostate gland. So these are the three things that I want to see. I want to get the information from my patient, and based on these three information that I have, I will decide what kind of treatment I should do for the patient.
Right, following to that, Doctor, what are the routine and dietary changes, supplements that are advisable to take for the patients?
Right. Now, as I told you, prostate cancer, we have got hypothesis saying that, high fatty food, high, lipid, high cholesterol increases the chance of having prostate cancer. So I usually advise my patients to stay away from, high calorie diet. There are also studies saying that, tomatoes help to reduce the risk of prostate cancer.
Right.
And also soya bean helps to reduce prostate cancer. But all these things are hypothetical, there's nothing confirmed here.
Okay, so your suggestion to practice what kind of food? Probably top 3 of your choice.
Yeah, I would advise my patients to stay away from high calorie, high cholesterol, high fried food, and more of vegetables would be beneficial for them.
And how about family members and roles to play in being a support system? Maybe for patients who are going through stage 2, stage 3?
Yeah, so now stage 2 is, let me tell you, patients who are going in stage 3 meaning patients who have got tumors which have, spread to other parts. That's a lot of burden to the family members, right? Now, family support is very, very important. In Malaysia, we have got prostate cancer support service system. In the sense, patients who are diagnosed with prostate cancer, we put them into a support group where they talk about their prostate cancer and all the other patients. Now, family members have to participate in the sense, there has to be encouragement, encouragement to be patient. Sons, who has fathers diagnosed with prostate cancer need to go in for screening at an early age. A lot of support has to be given by the family.
All right. So during the treatment, usually, in most cases, from your experience, what are the roles that family members play for the patient
during the treatment? Now, as I told you, treatment varies from each stages, right? Now, let's say if you talk about early prostate cancer, and let's say the patient goes in for surgery.
Yes.
What's important for the patient, for the wife to know is after the surgery, there is a 90% chance the patient is going to lose his erection.
Okay.
Right? Now, this has got a very strong impact in the in the marital relationship. Husband and the patient and the wife needs to be consulted properly about erectile dysfunction because it's an impact
for both sides.
Of course, we have got medications to be given after that, but it's definitely not a cure. So this needs to be emphasized. That's at the early stage of prostate cancer. At the when you have a prostate cancer which has already metastasized, at that stage there are a lot of support that needs to be given by the family members. patients can have pain over the bones. Patient, I've got a patient who has got a metastatic prostate cancer. Now, he's not able to walk, all his daily activities has to be done by the family members, Now, they can have, when they pass urine, they can have bleeding, All these things need to be addressed, and there is lots of counseling to be done at whichever stage of prostate cancer.
What would be your best advice, doctor, to all Malaysian men with regards to prostate cancer?
I would advise all men above age of 40, please get prostate screening done.
Okay.
Now, if it's normal, you can repeat one after 5 years. But that's not so for a patient who has got a hereditary prostate cancer. Hereditary prostate, like what I told you earlier, means, let's say the grandfather has got a prostate cancer. He needs to get screened first at the age of 40. And if it's normal, he has to get screening done every 2 years thereafter.
Right, okay. Thank you, Dr. Thana, for joining us on Medical Today.
Morning, Mr. Khairuddin.
Morning.
How are you feeling?
I'm very fine.
Right. How do you feel now compared to what you felt before the surgery?
Before the surgery, I got problem with the urine problem. Whenever I want to go to toilet, anything, so very hard to urine. So then only I come and see the doctor.
Okay. Now, after the surgery, how are you feeling?
I'm very fine.
How's your urination now?
Now urination is very fine.
So, I told you before the surgery, the most important complications is erectile dysfunction and incontinence of urine. That means you'll be having urine leaking. Now, how is your erection now?
Now erection is normal.
Normal?
No.
That means you have got, your erections are there. Your having
erection is there.
Is there. That's very good. That means I've done a very good surgery for you.
Yes.
Now, how is your incontinence? Incontinence means, is there any urine still leaking?
No, little bit. Once in a way.
Once in a way. Must you use any Pampers?
Yes, once. I mean, whenever I go outstation or what, I use.
You use Pampers.
Normal, I now use.
Right. So looking at your blood test, your PSA initially was 13. Now the PSA is less than 0.2. How do you feel? What's your feeling?
I'm very happy.
So indirectly it tells you your prostate cancer is being cured. Right? So what would your advice be to your other friends?
Once, whenever you got any urine problem, for the man, better go and see the doctor before the thing is worse. So I got no pain, nothing. Whenever I come and see the doctor, I got nothing, only the urine problem. So I come and see the doctor. Doctor advised me, you go for operation. Then only I go for operation. I asked my family. I told my family that I need to go for operation. They say, okay, you go ahead. Sure. Now I feel very fine. Very
good. Better than what you were
better
before.
Than. Yeah.
Thank you, boss.
Thank you.
It's a pleasure.
Okay.
Well, there you have it. Another interview for you talking about diseases of the genitourinary system, prostate cancer at your doors. Our on-site host, Nurata Amin, spoke to Dr. Thana Balan, a consultant urologist from Makotha Medical Center, and also Sagaran Ayapan, who suffered from prostate cancer, and he told us a little bit as to how one can cope with it. Stay with us right here on Medical Today. We're going to come back with an exciting video for you just after the break, talking about accidents and incidents, right here on Medical Today BNC. Hello Malaysia and welcome back to Medical Today with me, Sivaratnam. We now move into our final segment, which talks about accidents and incidents, a video we try to bring to you on a weekly basis. Now, a choking child is always a cause for worry and is most of the time an emergency. The first thing you need to do when dealing with a choking child is to dial 999. But let the video handle this. Let's take a look at our accidents and incidents video talking about a choking child, and we'll come back and give you a little bit more details right here on Medical Today. Let's take a look at this video.
Conscious infant choking usually cannot cough and breathe effectively. When you come across with this situation, you assume that the baby is choking. First, tap the baby heel and say, "Baby, baby, are you okay?" Then shout for help. "Somebody please call 999 ambulance." Immediately, take the baby, support the baby jaw with hand and arm on the baby chest. Head downwards to enable gravity to assist removal of the foreign body. Support the baby on your thigh. Deliver 5 back blows with the heel of palm in between the shoulder blades. Placing other hand at the baby head and support the neck. Turn the infant, make sure baby head is maintained downwards, and support the baby on the other thigh. Put 2 fingers in the middle of chest between nipples. Deliver 5 chest thrusts. Repeat 5 back blows and 5 chest thrusts until the foreign body expelled or baby becomes unconscious. If the foreign body expelled, quickly bring the baby to nearest clinic or hospital for further assessment. If the baby becomes unconscious, rescuer needs to proceed with CPR.
Well, hope that video brought about some insights and information with regards to a choking child and how you handle or deal with a choking child. Now, once again, I'd like to advise that you call 999 immediately if there's an emergency of this nature in your house. In the meantime, I'd like to thank the Regency Specialist Hospital for that video. Stay with us for more videos like that on a weekly basis right here on Medical Today. Now, if you do have any questions for us, you can send me an email or send us an email. Send it to ask@medicaltoday.my. That's ask@medicaltoday.my. What do you send? If you do have any doubts or questions and you need them answered by a subject matter expert or a doctor, we'll try to organize that for you right here on Medical Today. Don't forget, just to give you a heads up, next week on the show, on episode 8, we'll be talking once again about genitourinary problems. This time around, erectile dysfunction. Most men will want to know about this. And sexual transmitted diseases or STDs, all coming your way on next week's edition of Medical Today. I'm Sivaratnam signing off. You have a fantastic day ahead, and thank you very much for watching Medical Today on BNC.